Welcome to your screencast for tomorrow's lesson. What we're going to be looking at now is impact on training on lifestyle factors. Okay, so last week we looked at stretching, we looked at aerobic capacity before. So this time what we're concentrating on is the impact of training. So the impact of what we've been doing with regards to aerobic capacity, what that training will do to our lifestyle, and potential diseases that we have with regards to our lifestyle. Okay, so it's really important that we know certain lifestyle diseases so that are linked to the cardiovascular system and the ones that are linked to the respiratory system. We need to know how we can reduce the risk of these if we do appropriate exercise, i.e., submaximal exercise working at 60 to 80% of heart rate max for 20 minutes plus 3 times per week. So if we do that, we get adaptations that take place specifically to combat these diseases. So the diseases we need to be aware of for cardiovascular system are arthrosclerosis, coronary heart disease, heart attack, stroke. We need to know the effects of training on these diseases. And for the respiratory system, we need to know about asthma and chronic obstructive pulmonary disease, COPD, that is also known as, and the effects of training on these respiratory systems. Okay, so first of all, cardiovascular system is what we're looking at. The diseases we need to know: arthrosclerosis, coronary heart disease, CHD, heart attack, and stroke. So, arthrosclerosis, okay, so it is a build-up of fatty deposits in the arterial walls to form hardened plaque. That is what arthrosclerosis is. So hopefully this picture will help you out. This is known as the lumen of an artery. Okay, so this circumference here is known as the lumen. This is a healthy, normal blood vessel, and as you can see, plenty of red blood cells can pass through there and travel through there. What happens is the lumen creates a little tear, okay, and then from that tear we get a build-up of fatty deposits in the arterial walls. So as you can see, here's a slight tear and you've got a slight build-up of fatty acids. What then might happen, or fatty deposits, sorry, is these fatty deposits increase in size, and all of a sudden what you can see is how the blood vessels there are squeezing through this tight space. And you can see that there's not much space for the blood flow to actually go through. Now, arthrosclerosis, it reduces blood flow to the heart, which is an issue, obviously, because we need the heart to be able to pump oxygenated blood around the body. Increases the chance of a blood clot, which will result in a heart attack. So what eventually happens is these fatty deposits continue to get larger and larger, leaving the blood vessel more narrow, and then essentially a blood clot would form, and then no blood getting through, and then we have a heart attack. With this, our blood pressure will obviously increase as well. So arthrosclerosis is essentially a very kind of not important, but a disease that we need to be aware of, and we need to be aware of how to combat the kind of like how to prevent arthrosclerosis from happening, which we'll talk about later. Okay, so coronary heart disease. So coronary heart disease is the buildup of hard plaque, i.e. arthrosclerosis, which is a narrowing of blood vessels in the coronary arteries. Now this picture here will hopefully show you what the coronary arteries are and what they look like. So these arteries here, they supply the heart with oxygen, and they are known as the coronary arteries. So coronary heart disease results from arthrosclerosis of the coronary arteries, which supply the heart muscle with oxygenated blood. The reduction in blood flow and oxygen supply limits the cardiac muscle's ability to respire. Okay, this reduces oxygenated blood flow to the heart. This can cause an angina or heart attack. So coronary heart disease is due to the buildup of hard plaque, which is arthrosclerosis, narrowing of blood vessels to the coronary arteries. This will reduce oxygenated blood flow to the heart, which can cause a heart attack. So heart attack, okay, if a piece of fatty plaque, okay, breaks away from the artery wall, a blood clot may form. And it's important that we know that if the clot kind of like suddenly or severely blocks a coronary artery, as it cuts off oxygen supply to an area of the cardiac muscle, like the heart, it could cause death of cells and permanent damage, and then you get a heart attack. So what happens is severe or total blockage of a coronary artery. So again, the coronary arteries supply the heart with oxygen. Severe or total blockage of one of these arteries, so no oxygen will get to the heart wall muscle. This is usually due to a blood clot, arthrosclerosis. Okay, this then causes death, permanent damage to the heart. You get a heart attack. Stroke, okay, a stroke can be caused by a blockage in a cerebral artery cutting off blood supply to the brain. Don't worry too much about this term cerebral artery. All you need to know is a blockage cutting blood supply to the brain. So when you get a stroke due to a lack of blood supply to the brain, it's known as an ischemic stroke, okay? And that is what you need to know with regards to stroke. So when we talk about the effects of training on the CV system, if you start to exercise, you're going to get adaptations to the cardiovascular system, and you're going to prevent these lifestyle diseases that have just been mentioned taking place or happening, or reduce the risk of them. So we need to be able to use a fit principle for this. So the frequency, so to kind of like to have an impact on our CV system, we need to think of our aerobic capacity training. So frequency would be 3 times per week. Intensity between 60 to 80% of heart rate max. Time 20 minutes plus, okay, as a minimum. And then type would be low impact kind of submaximal work such as jogging and cycling, etc. Okay, so the effects it has on the CV system: decreased low density lipoproteins. Low density lipoproteins, okay, are they deposit cholesterol on the artery walls. So the less we have of these, the less kind of deposit of cholesterol, or less cholesterol we're going to have on the arteries, which is good. We're not going to have that buildup of fatty deposits. And this is because we have an increase in high density lipoproteins. Now, high density lipoproteins actively remove cholesterol from the arterial walls. So these remove cholesterols, these deposit cholesterol. We have less of these, more of these, act as scavengers and chip away at the fatty deposits. Okay, what is this link? Coronary heart disease. How does this link? Slows the development of atherosclerosis down, because we're not getting that fatty deposit being left behind. We're not getting that blockage, that build up within the blood vessel. So it slows development of atherosclerosis. Next one we should know: cardiac hypertrophy. So we get increased ventricular contraction, increased stroke volume. Why is this good? What's the link? Okay, increases the efficiency of the heart, lowered resting heart rate, lowers blood pressure, and reduces strain on the heart. Decrease in blood viscosity and resistance to blood flow. Remember, blood viscosity is the thickness of the actual blood, so it decreases blood viscosity, so it's thinner, so it travels through the arteries easier, and resistant to blood flow, so our blood pressure isn't as high. So the link is prevents blood clots from forming and reduces blood pressure. Increases red blood cells cell production, which means again increased oxygen transport to working muscles. Reduced resting blood pressure, which reduces chance of developing hypertension, which would lead to a heart attack. So they are the impact on training of training on lifestyle diseases. That's what would potentially happen or would reduce with us doing that. So we also need to be aware of respiratory diseases, okay? And it's characterized by one or several diseases of the airways or alveoli. And these include asthma, chronic obstructive pulmonary disease, COPD. We need to know the effects of training on these respiratory diseases. So asthma. Asthma is caused by the constriction and inflammation of the bronchiole airways, which limits breathing. So here we've got the bronchi, splits into bronchioles. As you can see, that's a normal bronchiole. Nice area, kind of nice circumference here for oxygen and air to be flowing through to the lungs. Asthma, you get inflammation and a constriction, so it narrows the airway. That's what asthma does. Asthma can be exercise induced due to the temperature outside. Chronic obstructive pulmonary disease, or COPD, a term used for several conditions of the lungs where the airway becomes inflamed and narrowed. So it's an umbrella term, okay, for one or more respiratory diseases. So it could be severe asthma, chronic bronchitis, emphysema, and where it's basically where persistent inflammation leads to permanent damage of the airway. So over time, inflammation leads to permanent changes, including thickening of the bronchi walls, increased mucus production, damage to alveoli, decrease in lung tissue elasticity. COPD includes severe asthma, chronic bronchitis, and emphysema, as I've just said. Smoking will have a detrimental effect on your health, and this is one of the diseases that long-term smoking can cause. Okay, several smokers will kind of suffer with COPD in later life. So the effects of training on the respiratory system, once again, we need to be aware of the frequency, 3 times out of 7, intensity, 60 to 80%, time, 20 minutes plus, type, low impact, kind of jogging, etc. So again, increased respiratory muscle strength, i.e. the muscles that help with respiration. So gas DD, or the mechanics of breathing, we need to be aware of, okay? Which decreases respiratory effort and alleviates asthma symptoms. Decreased resting breathing rate, which reduces the onset of fatigue, making everyday tasks easier. Inspiratory muscles are more effective, increasing airflow and reducing breathlessness, which reduces need for medication and improves quality of lifestyle. Medication being inhalers, etc. Up here, it's Dr. VPA, mechanics of breathing, Dr. VPA, not gas DD. That's to do with gaseous exchange. So apologies for that if you got confused then. Maintains full use of lung tissue and elasticity, which decreases risk of infection associated with COPD. Increases the surface area of alveolar and pulmonary capillaries, which maximises the efficiency of gaseous exchange and the health of respiratory membranes. Now, it's really important you make clear and precise notes with this. Last year's exam, this was a 10 marker, so we'll be going through this again in more detail tomorrow and be answering some exam style questions. Okay, thank you. See you tomorrow. Bye.